Much has happened in medical science since the AIDS virus was first identified in the early 1980s. The increasing urgency and public awareness of the HIV epidemic have stimulated much research in the field of immunology and pharmacology. This has resulted in the development of several increasingly effective antiretroviral drugs. Although new drug combinations have definitely prolonged lives and offered hope to many people, these medications often carry significant toxicities. Furthermore, HIV/AIDS is still not considered to be a curable disease, although there have been some remarkable recoveries and apparent cures in a small number of individuals. Single drug therapy was most common in early years of HIV epidemic, partly due to a lack of treatment options. However, with the development of multiple antiretroviral drugs and the emergence of resistant strains has given rise to combination drug therapy as the current standard of care. Highly active antiretroviral therapy, HAART, refers to a combination of antiretroviral drugs called cocktails that are now standard for treating HIV-infected patients. This combination therapy is normally begun immediately upon confirmation of HIV infection. There are currently 5 classes of antiretroviral drugs. Drugs from many of these classes are combined together into a single drug dosage form for ease of use. Although HIV/AIDS is a very complex illness, the mechanisms, the name of each action of the various drug classes are fortunately straightforward and distinct. The name of each class of medication provides a reminder of its role in suppressing the viral replication process. Reverse transcriptase inhibitors work by blocking activity of the enzyme reverse transcriptase. Reverse transcriptase promotes the synthesis of new viral DNA molecules from the RNA genome of the parent virus. Protease inhibitors work by inhibiting the protease retroviral enzyme. This enzyme promotes the breakup of chains of protein molecules as designated points, a process necessary for viral replication. There is currently only one fusion inhibitor. This compound works by inhibiting viral fusion. This is the process by which HIV virion attaches to the membrane of the host cell before infecting it in preparation for viral replication. The entry inhibitors CCR5 or co-receptor antagonists or CCR antagonists work by selectively and reversibly binding to type 5 chemogen receptor locator on the CD4 cells that are used by HIV virion to gain entry into the cells. The integrase inhibitors work by inhibiting the catalytic activity of the enzyme integrase, thus preventing integration of the proviral gene into human DNA. All antiretroviral drugs have similar therapeutic effects to varying degrees. They reduce the viral load, which is the number of viral RNA copies per milliliter of blood. A viral load of less than 50 copies per milliliter is considered to be an undetectable viral load and is a primary goal of antiviral therapy. Despite the effectiveness of HAART, prescribers may still need to alter a given patient's regime in cases of major drug intolerance. The need to modify drug therapy because of adverse effects is not uncommon. The goal is to find the regime that will best control a given patient's infection and that has a tolerable adverse effect profile as possible. Use of HIV antiretrovirals requires close assessment of allergies, cautions, contraindications, and drug interactions. A thorough assessment of the patient's medical history, vital signs, baseline weight, allergies, medication history, and results of baseline laboratory tests such as a CBC, RBC count, and renal and liver function studies. The laboratory tests are also generally ordered during the 4 different phases of treatment, and results should be documented appropriately. Assessment of the patient's knowledge about the illness and the need for long-term and often lifelong therapy is crucial. In addition, a knowledge of the patient's educational level, reading level, the way in which the patient learns best, and familiarity with community resources is important to implement patient education effectively. Assessment of mental status and emotional state is important because of the psychological impact of chronic illness. Value systems, social patterns, hobbies, support systems, and spiritual beliefs should also be noted and documented. For patients with chronic illnesses, the synthesis of information will help ensure the development of a nursing care plan that is complete and holistic. Comfort measures and supportive nursing care should accompany drug therapy. Patients should be encouraged to drink plenty of fluids and to space medications around the clock as ordered to maintain steady blood levels of the drug.